Hello, welcome everyone. My name is Terrell Parker, and I am the manager for the Escalate program. We're really excited to have you all here with us today, and we're excited to share an overview of the fabulous, amazing Escalate project. And hopefully by the end of today's webinar, you will find a way for your organization to engage with Escalate. So without further ado, let's get started with today's webinar. Next slide. Of course, we cannot do this all of this amazing work without our fabulous team who is all on the call today. In the interest of time, everyone will not be introducing themselves, but I'd just like to welcome Charles Shazer Jr., our Center Director, Cora Treyes Cartagena, who is now our Associate Manager for Escalate, Christopher Paisano, our Indian Country Coordinator, Darnell Green, our Social Media Coordinator, and Marshawn Redmond, who is now our Logistics and Operations Coordinator. Thank you to our fabulous team, and of course, our amazing partners who will introduce themselves later from Newark at the University of Chicago and TRX Development Solutions. Next slide. Of course, the work that we do with Escalate could not be possible without the vision and the foresight of our funders. Escalate is supported by the Health Resources and Services Administration of the U.S. Department of Health and Human Services, specifically the Minority HIV/AIDS Fund. Next slide. So for today's webinar, as I mentioned earlier, we will provide a broad overview of the Escalate program. You'll learn ways to engage with our innovative Escalate stigma reduction training. You'll learn the benefits of participating in our technical assistance. You'll also learn how you can grow with others through our learning collaborative. And then we'll provide a space and opportunity for you to ask questions from our NMAC team and our partners who are on the call today. Next slide. So I always like to start with why Escalate, because it's really important. It speaks to the urgency of the work that we do and the urgency of the need to address HIV-related stigma. So Escalate was created to reflect the mission statement of NMAC. If you know our mission statement is that NMAC leads with race, to urgently fight for health equity and racial justice to end the HIV epidemic in the United States. Now that's a heavy mission statement, but what does that mean? It means that we look at HIV through the lenses of people who are most impacted by HIV today. Unfortunately, we know that those are primarily communities of color and members within the LGBTQIA communities. Next slide. So one of the primary beliefs of Escalate is that we cannot end the HIV epidemic if we do not take a serious look at eliminating and reducing HIV-related stigma. So what does Escalate specifically do, and how can it help your organization be better prepared to address stigma? Escalate trains and builds the capacity of participants, hopefully you all, to recognize and address HIV-related stigma. So first, to be able to recognize stigma, what is it? What does it look like? How does it show up in our communities? How does it show up within our clinics, within our community-based organizations, or sometimes within our health systems? And then how do we go beyond just recognizing HIV-related stigma? How do we address it? So how do we reduce stigma for people living with HIV at every level? So individuals, like people living with HIV like myself, how do we reduce the stigma that we feel? How do we reduce the stigma within organizations? So when people come into your organizations, the stigma that they feel, and how do we do our part as healthcare professionals and leaders to dismantle systems that perpetuate stigma? So Escalate focuses on implementing various stigma reduction practices and approaches. We emphasize cultural humility, but what I want to emphasize, what's most important, is that we hope to empower people with the tools that they need to go back into their communities and create the change that we need to reduce and eliminate stigma. Next slide. through the lenses of communities experiencing stigma. So when we look at Escalate, we want to know, who are we focusing on? NMAC very intentionally focuses on our efforts on communities that experience stigma the most. And these are some of the communities that we have listed today: transgender and gender nonconforming communities, men who have sex with men, Black African American communities, Latinx communities, and American Indian, Alaska Native communities. As we always like to stress, what was critical to the design of Escalate was bringing these communities to the table and making sure that we listened to them to make sure that we created a program that truly addressed the types of stigma that these communities face. Next slide. So, who does Escalate engage? Who are we hoping to see participate in our program? You. Escalate specifically is designed for recipients of Ryan White HIV/AIDS program. So those are Part A recipients, Part B recipients, Part C, and Part D recipients as well. That includes health departments, community-based organizations, federally qualified health centers, planning councils, planning bodies. But not only that, we want to make sure that we see participation from people within every level of your organization. So from your frontline staff to your front desk workers, to your case managers, all the way up to your senior officials, like your CEOs, and also your health professionals, like your clinicians, your nurse practitioners, the people who provide medical services to our clients as well. And we also believe that if we're going to do this work, it has to be a partnership between people living with HIV and the organizations that we work for. And that's why we require each stigma reduction team that participates in Escalate to have one person living with HIV who is from the community, who is open about their HIV status on your team to help us do this work, because it truly must be a partnership. Next slide. So our Escalate model, before I transition it over, focuses on three primary components. That's our innovative stigma reduction program, our targeted time-limited technical assistance, and our learning collaboratives. So you'll hear more about each aspect of Escalate next. Next slide. So I'm going to pass it over to Chris, who's going to talk more about our Escalate organizational training. And Chris has a really great analogy. I like to say that there's no wrong way to enter the Escalate program, but Chris has a really great analogy. If you're wondering, okay, there's three components to Escalate. How do I fit in? Chris, I'll turn it over to you.
Hey, everybody. Good afternoon or good morning, whenever you see this. So, Yate Tokoatse. And so that's greetings from the Navajo Nation and Laguna Pueblo. And yes, so before we start even talking about this, the three different parts and tracks that we have for Escalate, let me just sort of break it down so you can see it visually. So of course, as Terrell had mentioned, we have three tracks: organizational training, which is what I will talk about. We also are talking about technical assistance and learning collaboratives. And the best way to get your mind around that is to just think of a mountain. So I just came back from Alaska, and those mountains are always covered with fog. So what Escalate organizational training does is that it allows you to see the mountain that is before you, and they're climbing up against stigma. That's basically what it is. It helps you to see the mountain and where you need to go as an organization to better support those living with HIV against stigma. The next part of that would be technical assistance. And in technical assistance, that is when you're going to start learning how to climb a mountain. So you're going to have some set goals that you want to do, and you're going to come and come together. We will work with you. You will figure out how you start beginning to climb that mountain and move forward with achievable goals. Now, learning collaboratives is when you want to go all the way to the top of the mountain, where you want to work with experienced mountain climbers, if you want to call it that way. And so together, you learn best practices. You're going to learn the best way to climb up that mountain, so at the end of your LC experience, you will have reached the top of the mountain together, and you have achieved what you had wanted to eliminate and reduce stigma in HR and HIV clinics. Okay, so with that, let's begin with the next slide. All right, so what are the benefits of participating in training? Well, first of all, just being able to meet very smart people from across the regions, whether it's in your local region or across the US, to figure out how best the challenges of reducing stigma. And so here, the curriculum is so beautifully written and beautifully presented that you will have transformative and relational changes in your organization. And also, you're going to learn how to facilitate those changes. So as you begin to look and see, you'll be able to figure out, this is what we need to do. How can we do it? And part of that is also through cultural humility. And in cultural humility, it's always not a one-shot deal. It's always something that you can always learn in depth. So you go through the training and you learn yourself, either one, what have I continued to do or have done in the past that is stigmatizing, and or three, also in what others can do and what others have done. But we always want to look internally and reflect on ourselves and always go deeper. There's never ever going to be an end point. So when we reach cultural humility, and anytime we have challenges within our clinics, we'll be able to adjust that, take it in, and meet those challenges so we can start supporting those living with HIV. And then the last point, of course, our participants will learn how to address their own internalized stigma, those things that we either have experienced, or more importantly, those things that we have done to others or continue to do in the clinics and how they're set up. That's a real quick example is perhaps we have a big sign that says AIDS clinic. Maybe we have to have our clients walk all the way through the clinic and through staff areas. And so people know that whoever goes back there, they're going to get HIV services. And so all of these things, we're going to look and begin to take the fog out of our eyes so we can begin to see the mountain that's ahead of us. Next slide. So as you say, Escalate is a 5-day training. I like to start at 9 in the morning and end about 5. Sometimes it's a little bit earlier in terms of ending. But really, as you see the agenda before you, it lays out really the curriculum on each day. And so at the end of day 1, that's the foundation so that we understand what stigma is. We recognize the different kinds of stigma in healthcare. We look at social constructs and race. What is that? And we begin to see that in the systems that we live in, sometimes we don't even recognize those systems. So the Escalate on the first day lets us be like fish in the water. We can actually see the water around us, which is the water systems of change. We then begin to merge into cultural humility, learning what that is, learning that we can never, ever achieve an absolute point of understanding or experience cultural humility. We learn to then begin to speak on interaction activities where we can begin to have those dialogues. We begin to see how we see the world, each of us on our own lenses, and how that interacts and how we interact with the whole world individually through our past and our present. We move to privilege, intersectionality, and observing and disrupting implicit bias. Day 4 is beginning to get those skills where we begin to learning how to have those difficult dialogues with ourselves as well with our colleagues and others, and even our family. And as we then understand that when we start addressing privilege, we have to recognize that there are natural defenses that as human beings, we will begin. So these things are quite normal when we try to address our own stigma or other stigma. Day 5 is really, I think, the jewel of it, is where we have the Escalate organizational self-assessment. This tool really helps you see those parts that you possibly have not seen in the past or presently within your organizations, so you can see those parts that are missing. For example, you may actually have stigma policies, but if you don't know about it, or if anybody else doesn't know about it, it doesn't really help anybody if it just sits on the shelf. What the Eosa, as we call it, helps you do is give you a nice view of what is going on in your organization as it pertains to you, and everyone comes together and you begin an action planning with team action planning, so you can begin to address those things. By the end of the Escalate, you can see the mountain before you. Eosa will begin helping you sort of begin mapping as you begin climbing that mountain. And of course, at the end, we always have a great closing and graduation. a lot of tears, a lot of laughs where everybody has gone through. And I would even say every time the trainers are also deeply affected. So we're happy about that as well. And we move on to action planning afterwards. Next slide. And we're transitioning. All right. So like I said, here are the training on the left, training opportunities. So we've got in 2022 in Puerto Rico, and it's in Espanol. And then as you can see, we're going to Texas and San Francisco, Las Vegas, Memphis, the Bronx. That's also going to be a great dual training where we have one in English, one in Spanish, ending up and rounding up our year in Detroit, Michigan. And so we've got the 3 different types. We've got a national cohort, which is what I just went over. And then we can have organizational training where we can schedule an in-person training for your entire team. So on the left side, we have people coming from all over the country of 3 to 6 people that will make up a team, and they all meet together. But say you want to train everybody, we can do that one-on-one. We're very flexible. So we understand that folks cannot always do a whole week. We can do 3 days or 2 days in person, and then the rest we can do over Zoom and continue that training that benefits you. So great customer service. And on demand, we are excited about this because we have Escalate recorded and in a way that you can go in and take Escalate on your own time, as well as if you've gone to the training, you can come back and get a refresher course. I'm really excited about that as well. So also visit targethiv.org/escalate. That gives you all of the training dates, as well as, more importantly, a link to go and to apply for Escalate. All right. So next slide. And of course, these are the ones in Espanol. We've got San Juan, Puerto Rico, San Antonio, and in the Bronx as well. So this is totally in Spanish, including not just the facilitators, the slides, the curriculum, everything has been translated into Spanish for those who are better want to grasp Escalate in their native language in Espanol. So take a note of those and please fill out an application, which is also in Spanish on Target HIV. All right, next slide. And okay, I'm going to turn it back over to Terrell, and we're going to talk about technical assistance as you begin to climb up that mountain. All right, Terrell.
All right, thank you, Chris. Thank you very much. So as Chris said, what does it look like for you to begin to climb the mountain, and what type of support do you need? Because we know this stigma is a large challenge, it's intersectional, and it impacts most of the work that we do. So we believe that we want to provide the support that organizations need, as Chris said, in order to be able to assess where they are in addressing stigma, being able to create a goal, a realistic work plan, and to help you implement those objectives as you work to reduce stigma within your organization. Next slide. So as I mentioned, Escalate Technical Assistance is specifically to support Ryan-White HIV/AIDS program recipients and subrecipients in addressing both internalized and externalized HIV-related stigma and discrimination within healthcare. So as Chris mentioned, one of the primary frameworks for the Escalate training and the Escalate program overall is cultural humility. And one aspect of cultural humility is self-reflection. So that's why it's important for organizations, not just us as individuals, but also from an organizational perspective, to address both the internalized issues, those issues that we have within inside our organizations and our clinics, and also those outward facing externalized issues as well. Similar with our training and our learning collaboratives, Escalate Technical Assistance is open to all Ryan-White providers, parts A through D. Next slide. So we call Escalate TA version 2.0 because we've made some slight modifications from our original technical assistance cohort. We just wrapped up our very first cohort of technical assistance, where we had 12 organizations from around the country complete technical assistance over 9 months. Part of our continuous quality improvement model is to make changes to better serve our clients and our constituents. So we took our Escalate technical assistance model and we revamped it slightly so that we can maximize our efforts and increase the work that we're doing to reduce stigma. So here are the basic tenets of our slightly modified technical assistance program. So as Chris mentioned, if you go through our training, you will complete the Escalate organizational self-assessment. That is an assessment that is consistent across the board, whether you go through training, technical assistance, or learning collaboratives. So you will also complete a EOSA if you are a part of TA as well. So what the EOSA does, as Chris mentioned earlier, it allows you to see a high-level overview of what your organization is currently doing to address HIV-related stigma. And also, what is your staff's knowledge and awareness of what your organization is doing to address HIV-related stigma? So each team begins with completing the EOSA, and then you will receive an aggregate for your entire agency for all of the members of your stigma reduction team. We then utilize that EOSA to develop TA goals. The EOSA is then used to evaluate your TA activities and your agency efforts. So the EOSA is critical to the work that we are doing because it allows us to see that high-level view of our efforts, and then it allows us to use that to create specific work plan goals that will drive your TA efforts. Next slide. So what does it look like to participate in Escalate TA over 9 months? Well, you will first complete an orientation after you submit an application. Applications are now accepted on a rolling basis, which is slightly different than our original TA model. So you can apply for Escalate TA at any given time throughout the year. First, you will complete an organizational orientation with your stigma reduction team and our NMAC staff. Next, you will complete the baseline assessment, which, as we mentioned earlier, is EOSA. You will then work with our NMAC staff to develop a work plan. We will also assign you to work with a subject matter expert that is specifically focused on having the knowledge and expertise of your stigma reduction project. Later on, we will discuss a few examples of various types of stigma reduction projects we've seen so far. But we also feel like it's important to match you with someone who can best meet your individual organizational needs. After developing your work plan, we will focus on implementation. How do we then work towards achieving our action steps and goals? And then finally, we will do an outcome assessment. Near the end of your TA cohort term, we will then assess how well have you worked towards achieving the goals of your original work plan. Next slide. So what do we expect from you if you are participating in technical assistance? Next slide. Agency expectations. Once again, we believe that this work must be done in a partnership. So we believe that it is important to form a stigma reduction team. Once again, you must have 2 to 6 members of your stigma reduction team. Your stigma reduction team must include a person living with HIV who is from the community that your organization serves. They must also be open about their HIV status. We also ask that you designate a stigma reduction team leader. This will be the person who is responsible for communicating with NMAC, who is also responsible for championing your stigma reduction efforts, and also making sure that your team stays committed through technical assistance throughout the 9 months. We also ask that you commit to 1 short-term goal, 1 intermediate goal, and 1 long-term goal. So what is 1 goal that we can accomplish maybe over the next 30 days? What is maybe 1 goal we can accomplish over the next 3 months? And then what is 1 goal that we hope to accomplish over the full 9-month duration of technical assistance? Next slide. We also asked, as we mentioned earlier, the baseline assessment meeting will be 90 minutes. The work plan meeting will be 60 minutes. In addition, we will have 1 hour monthly TA provider meetings where you will have an opportunity to meet with the NMAC staff and your subject matter expert to discuss the progress of your stigma reduction plan. And finally, we will have one 60-minute outcomes meeting at the conclusion of your stigma reduction project. Next slide. We mentioned many of these steps already. We expect you all to complete the EOSA, attend all of the meetings. We expect that you contribute to the development of the work plan. As I said, you will have a subject matter expert and the NMAC staff, but we will work with you to develop the work plan. Attend our monthly TA provider meetings throughout the duration of the project. We ask that you support the project with the lived experience and professional experience and expertise. And lastly, we ask that you commit to transformational change. We have seen many of the organizations that participated in technical assistance during our first cohort, they did experience some challenges. And we do understand and recognize that this work is not easy. So we ask that as a stigma reduction team member, that you make a commitment to transformational change. Next slide. So what are our TA touch points throughout the year? Next slide. So if you participate in TA, the agency orientation is conducted within 7 days of notifying the applications. We will review the applications monthly, and we will send out monthly communications as we bring on new TA sites. So our application for technical assistance is open online on Target HIV. Let's say, for example, you apply this month, you would likely get notified sometime in October that you've been accepted into the TA program. Within 7 days, you would be notified and we would schedule your agency orientation. The purpose of the orientation is once again to review the expectations of TA, to review the process and respond to any initial questions that you may have. This orientation is mandatory for your agency participants. Next slide. As we mentioned earlier, after the conclusion of the initial meeting, you will complete the baseline EOSA assessment. Next slide. After you complete the EOSA assessment, we will compile your results within 1 week's time, send those results back out to you, and we will schedule your first TA provider meeting where we will focus on developing your TA work plan. Next slide. So what does the EOSA look like, and what are some of the focus areas that we are concentrating our TA efforts on this year? So we're looking at organizational policies and procedures, your organizational cultures and environment, your workforce development, cultural responsiveness, and also organizational change management. So as Chris mentioned earlier, what are the policies and procedures that your organizations have to address stigma? Is your staff aware of those policies? Are those policies routinely reviewed? Is your staff trained on those policies? So it's not just, as Chris said, it's not just about having a policy in place, but truly making sure that we are doing our due diligence to prepare our staff to understand and implement those policies. So going beyond policies, what is the culture of your organization? How is that fostering leadership to support anti-stigma policies, procedures, and practices? And next, workforce development. So what are the core competencies of your staff? Is your staff prepared to address stigma? And what capacity building needs to take place in order to prepare your staff to be agents of stigma reduction? Cultural responsiveness. As we mentioned earlier, cultural humility is a primary focus for the entire Escalate program. So how is your staff prepared to be culturally responsive to the needs of the community? And lastly, organizational change management. How do we build the momentum for change as we look to address stigma? Many of our practices, many of our beliefs, in our organization are often unconscious. They're often things that aren't taught, but they're things that have just become normalized over time. And we found that those things are often difficult to change. So how do we truly build the momentum and prepare our staff to be ready for the changes that we try to implement as we continue to do this work? Next slide. So from there, after completing the EOSA, you'll have a pretty solid framework and understanding how your organization is doing in addressing those 5 areas that we just mentioned. And from there, you will identify 1 to 2 of those EOSA domains to focus your TA goals. Then the fun part starts. We help you actually address and implement goals related to each specific EOSA domain. So I'm just going to take organizational change, for example. Here's some really great examples of goals that previous TA participants decided to work on for their time in TA. So a short-term goal, for example, might be to just conduct the baseline measurement of stigma in your environment. What does stigma look like? A 3 to 6 month or intermediate goal was to establish an anti-stigma plan. And a long-term goal, greater than 6 months, was to conduct organizational strategic planning for equity. So that's a great example of what a stigma reduction goal would look like: short-term, intermediate, and long-term. Next slide. As we mentioned earlier, you will meet with your monthly TA provider for updates on your TA work plan and to receive any support, encouragement, or resources that you need to continue doing the work. Next slide. And finally, your agency outcome assessment that we will complete at the conclusion of your TA is once again the EOSA. So we will be able to compare what your organization was doing to address stigma at the time of beginning TA versus your efforts moving forward. Next slide. And if you want to apply for technical assistance, it's a fairly simple process. Next slide. TA applications are open and we're accepting them online now on a rolling admissions basis. You can visit targethiv.org/escalate to complete a TA application today. Next slide. And we're going to save questions for the end, and I'm going to toss it over to Sarah, who is going to provide updates on our next Learning Collaborative cohort.
Great, thank you so much, Terrell, and hi, everyone. My name is Sarah Hodge. I'm a research scientist at NORC, and I am one of the Learning Collaborative liaisons for our current Learning Collaborative, and we'll be working on the second edition of our collaborative as well. If you want to go to the next slide. Great, so there's my name and affiliation. Go to the next slide. All right, thank you. So I'll be talking a little bit about what a learning collaborative is and what you can expect to get out of participating in the Escalate Learning Collaborative. A learning collaborative is a type of group learning, and it's an effort to bring organizations together to learn from one another and from experts to study and apply quality improvement methods to a focused topic area of interest. So this generally will involve a commitment of a year or longer to participate in regular learning sessions that will be facilitated by experts in a specified topic area, and then also engaging in action periods between those sessions to apply the learned content to your own work. In the Escalate Learning Collaborative, we're asking organizations to participate in a multi-step process of developing, planning, implementing, evaluating, and then refining a stigma reduction initiative for a specific and selected population of focus. So your team will receive coaching, opportunities for peer-to-peer learning, and support from stigma reduction subject matter experts. In addition to that, you'll also engage in collaborative tracking of your progress and practice some continuous quality improvement techniques that will help enhance your initiative over time. Next slide. Thank you. So over the course of the Learning Collaborative, with support from subject matter experts and similar peer organizations, your team will have the opportunity to engage in a few different activities. So one of them will be assessing the stigma-related needs of your client population, and that'll be done by looking at existing data or collecting new data on clients' experiences with HIV stigma and other forms of stigma or discrimination that could exacerbate their experiences with HIV stigma. And those could be things like experiences of racism, homophobia, or transphobia. You'll also work on selecting stigma reduction activities that meet those defined needs that will be affecting your organization's policies, procedures, staff, and clinic environment. We'll ask you to develop a formalized stigma reduction initiative, and that will include developing both an implementation plan and an evaluation plan for your proposed activities. Developing the plan for implementation will include identifying SMART goals and objectives, putting together a timeline for implementing those activities, and looking at what resources are needed to implement your activities successfully. Creating an evaluation plan will then involve identifying the evaluation questions and linking those questions to project components from your implementation plan. And then last, you'll engage in evaluating, testing, and refining your initiative through the use of quality improvement activities like what you may have heard them called PDSA cycles, like Plan, Do, Study, Act cycles. Next slide. So to be eligible for participation in the Escalate Learning Collaborative, we ask that organizations be a HRSA Ryan White HIV/AIDS program Part A through D funded recipient or subrecipient, so Part A, B, C, or D. We ask that you be interested in creating an evidence-informed, comprehensive stigma reduction initiative and be willing to engage in efforts to improve the performance of that initiative over time. We ask that you have a foundational understanding of HIV and related stigmas that may be experienced by your clients. And we'll ask for a written commitment from your organization's leadership to provide resources and tangible support for the development and implementation of a stigma reduction initiative. Next slide. Great. So now I wanted to talk about who would be participating in this type of activity in this learning collaborative. And one of the important things I think to note is that organizational change can't be achieved by just one person. So it's a team effort, and each organization applying for the learning collaborative will need to identify a team of 4 to 6 participants who will form a stigma reduction team. And this team must include someone in a leadership position who can help implement changes at the organization and also assign resources to the initiative. This person will be what we're calling our stigma reduction change agent, and they will be responsible for leading the stigma reduction team. We'll ask that you have individuals who represent members of the population or populations that your stigma reduction initiative seeks to serve. And we'll also look for people who represent a wide range of roles and seniority within your organization, including both client-facing staff, so frontline staff, case managers, patient educators or navigators, providers, and then also administrative and other vital support staff who don't regularly interact with clients. And those may be people who work in human resources, billing, or finance. Next slide. So next, I wanted to get into more specifics on the activities for the Learning Collaborative and the learning sessions. So to kick off the Learning Collaborative, your team will participate in an initial in-person orientation to meet your fellow collaborative members and begin laying the groundwork for successful participation in the Learning Collaborative. For this collaborative, we'll have 6 learning sessions, which will be virtual sessions spread over 2 days that offer an opportunity for organizations to interact with and learn from each other and from subject matter experts. Each of these learning sessions will include a learn segment, where we'll have presentations from our subject matter experts that are intended to build teams' knowledge about stigma reduction. We'll have prepare segments that will walk teams through different tools that you'll be using to support the activities conducted during the following action period. We'll have an apply segment that offers teams an opportunity to begin applying the tools and the content to the activities that they'll be working on with support from a coach or a liaison. And then a share segment that provides an opportunity for teams to describe their progress to one another and offer each other input on solutions and challenges that may emerge. There'll be about 2 to 3 months between each session, and we're calling those our action periods. So there will be 5 action periods during which your team will meet to develop and implement your stigma reduction initiative, supported by check-ins with coaches or liaisons, and affinity group meetings where you're combined into groups with organizations that are similar to yours, who therefore, might have similar challenges or experiences. Next slide. So just to kind of more clarify what we mean when we're talking about some of these requirements, this learning collaborative will be convened over a 16-month period. And team members will ask to devote about 6 to 10 hours per month to the activities. So this will include time for the learning collaborative session itself, also meetings with your LC liaison or your affinity group, and then work that's needed to actually conduct the activities and use the tools that have been provided during the session. This will be in addition to any of the work you'll do to actually implement the stigma reduction initiative, which may vary depending on what activities you plan and the intensity of your expected efforts. Next slide. Our spring 2023 Learning Collaborative application period is going to open in fall of 2022, so in the next few months or weeks. So please consider whether your organization is ready to engage in this work, and we'll ask you to apply on targethiv.org. If you don't feel like your organization is quite ready, we would absolutely encourage you to apply for the Escalate training or technical assistance tracks that my colleagues earlier were describing. And then also we'd want to ask you to keep an eye out for our Escalate digital stories. So those will be posted on Target HIV as well, and those will include some of our current Learning Collaborative members' lessons learned, successes, and any pitfalls that they may have experienced that they would like you to think about, the type of work that they did and how they anticipate it will support their clients in the future. Next slide. So we do have an email address right there just to talk specifically about the Learning Collaborative. So please feel free to send any questions you have and connect with me and my team via email at escalate@norc.org. And there's also the link there for more information about the Escalate initiative at targethiv.org/escalate. Next slide. Great, thank you. Thanks for your time, and we look forward to hearing from you. And I'll turn it back over to Terrell.
Thank you, Sarah. And next slide, Marshawn. So as we've mentioned, you've heard it all before. If you're interested in applying for either aspect of the Escalate training, please visit targethiv.org/escalate for more information. Next slide. Oh, and we just ask that you download the application first and view the application, prepare your responses, and then begin working on the application. I see that we have 2 questions in the chat box, and then we'll open it up for any other questions. The first question that we have, is there any chance of bringing the training to Atlanta in the future? There is a possibility. I'll say never say never. So Escalate is a 4-year cooperative agreement. We have had some discussions for our next project year, which would not begin until September of 2023. So it's not on our official training schedule yet. It could be added for 2023 to 2024. But there's also, as we mentioned earlier, if you'd like to reach out to us directly, we'll put our combined email address here. Escalate@nmac.org. You can just reach out to us directly and we'll follow up with you on working to schedule a training for folks in Atlanta. But also keep in mind that the national trainings are open. So if you'd like to put together a team to participate and come to one of our national regional trainings, then that is also available as well. I know we're doing one training specifically in Charlotte, North Carolina, which is situated in the South. And I also see another question. Can you participate in training and TA or training and the collaborative, same people or different people for each? Well, we've actually had that happen. So we've had it happen both ways. We've had some people start with training and then like Chris said, they're able to see the mountain. Now they're ready to climb. And they sent a team through the training first, and then they sent a team through TA as a follow-up. We've also had it done in reverse. We've also had a team participate in TA and then said they want to send a team to training. So they sent a different group of people to the training while some of their other staff participated in TA because they wanted to expand the amount of knowledge throughout the entire organization. So I would say absolutely, it's definitely possible for you to send a team through training and TA or training and the learning collaborative at the same time. All right, and are there any other questions? All right, well, I don't think we have any other questions. Darnell, did you have any questions? Did anyone send you any questions? If not, as I mentioned, you can find us on Target HIV, targethiv.org/escalate. You can email us at escalate@nmac.org, or you can contact us via phone. We look forward to seeing from you, hearing from you, and hopefully we will see you in one of our training rooms shortly. Thank you very much for joining our webinar. We hope you have a fantastic weekend. And if you're going to USCHA, safe travels, and we'll see you in Puerto Rico.